friends to Maestro once again. And today, amidst this pandemic, I really feel very worried about the governance that is going on in around us, not only in India but across the globe, especially in the Indian praxis or especially in the scenario. I feel there has been a tragic failure in the view of an administration and governance in management of this disasters and pandemic management. As going through all the reviews, all the journals, and all the studies that has been made from last 2 years, and also in the recent past, in last 1 and 2 years, about the pandemics, about the vaccinations, about the development, about the problems and solutions, about the causes and the actions about to take. But what I found that there is a great gap between the intention and the implementation. There's a great vacuum that exists between the intention and the implementation. Of course, the government or the administration intentions are really very noble and they really want to help up in that regard. But biggest problem or tragic that has been going on is the getting, I always say like that, getting training by untrained people. Uh, it may be because of their political disability or what you can say, or the political priority that they don't want to admit it and they don't want to take the measures that requires a really serious involvement of each and every individual to fight with this pandemic. If you could really see, we are going through this pandemic situation since last 1 year. In India, the lockdown was insisted on 24th March 2020. It almost went for 6-7 months, and then slowly it was went out. And again, after second wave, the constraints were. And right now, the situation has moved from bad to worse. Today, or in the April 2021. So you can see the situation has moved from bad to worse compared to the last year. There has been no oxygen, there has been fire casualties, there has been the cases of lack of medicines and vaccinations. Even the basic treatment things are not available. I'm getting the messages, calls and things, even from the medicals, and those who have been expertly practicing so many years and asking and demanding their friends and kith and keens and associates were asking for the medicines and remdesivirs and other basic elements treating materials. Why are we so paralyzed the systems? Because we have not followed the very basic traits that stitch in time saves nine, to build a shelter against rainy day. Why it's all the time that when we feel thirsty we start digging the well? Why we don't have a vision, a mission, a proactive behavior? Why don't we have a clear projections? Is that our leadership lacks the vision, or they are too blind, or I'm sorry, I beg your pardon to say, maybe dumb and deaf to the suggestions, or dumb or not to understand what could this Titanic or this iceboat could turn to? We are dealing with a separate kind of war. It requires a different war tactics, and we need to understand and materialize the priority that what we need to concentrate and focus on. Since last 1 year, we could not make the arrangements for the ventilators, could not increase the capacity. In spite of having the vaccines in our hands, we are finding it really very miserable to fight and give a competence and to for fight with the COVID scenario. I feel that need to be really worried about. And government is really behaving like philosopher, confusing others and concluding themselves. And they feel like with the blah 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 of explanations and giving the numbers and giving some exercises and rolling and coming on things, they are going to lure the peoples or make them ask. It's not going to work, because everyone has their patience capacity. There's a limit for everything. There will be another outburst of volcano in the post-COVID scenario, and that will be of a grief, of the tragedy, that will be of a poverty, that will be of a hunger, that will be of an unemployment, and that will be a bigger disaster than this. And I think for in that all accord, we need to great management. Why can't there will be a small capsule training programs. If we not talk merely about problems, let's talk about solutions like that. If we talk about the scarcity of our medical force, really, so why can't there be a small capsule training program for all the medicals, for the final years medical graduates who are about to graduate or who enter the internships, third year graduates, the paramedics, like from physiotherapists, occupational therapists, dentists, or the microbiologist. Why can't there be small capsule programs on epidemiology or epidemics, and they've been treated like that, to how to take care of the patients, how to work on that, and how to give what are the disciplinary medicines and if taken, and then appoint a specialist, maybe MD or GM, about that to look after the things. Why can't we utilize our paramilitary forces? Why can't we utilize the students from their NCC, NSS, the scouts, at university levels? Those are giving the certificate examinations for maintenance of the administration. Why can't there be capsule things? As we can see in the case of Japan after the Second World War, when the Japan was totally destroyed and deteriorated, and Hiroshima, after the Hiroshima Nagasaki nuclear attack, and there was no ray of hope like that that Japan will rise again, and they started building themselves and they started working. They were not having time for teaching or going for everything like that. When they were ordering the machines and they were getting from other parts of the country, so they were just, when they used to get the manuals in English, they just used to make the translation of the things which is important for them, and that was a part of their training. And from English to Japanese, or from Russian to Japanese, or whatever, like that they used to make it. And then slowly they have gradually built it up, because they were not having time for the prolonged education, but for the short trainings. That is the things that we need required: a short trainings, a small trainings, a small accord, and then to proceed. If we utilize all these medics and paramedics and the students' forces also in nursing, in dentistry, in physiotherapy, in the medical colleges, we'll be having a better and bigger force. We need to have sub-health centers that need to work it on along. We need to involve the NGOs, we need to involve the social organizations at one part of it, by taking all the care, by taking all the measures up in that regard. I really find really strange. In most part of the countries, there are not cold storage also. We need to establish immediately the cold storage that can be utilized for storing the medicines. Now in the later, it can be dedicated to the farmers for storing their goods. And that will be utilitarian in that manner. Can pass it on. It can be built on the private-public partnership, the PPP model like that. There are things, but it requires an intentions up in that regard. And looking at the lockdown scenario also, suddenly we need to make an homework for the things, we need to make an understanding, and I feel a comprehensive plan need to make. Here exactly looking at the scenario, it needs minimum 7 week, out of 7 week, 28 days of the lockdown is required. But 1 month lockdown, rather than keeping it like that, we have to make it. What I am suggesting right now is a Maestro SandClock model, is that we need to make a lockdown in 7 weeks properly. But it shall not become a lockdown. In first week it should be for 7 days, second week it should be for 6 days, third week 5th, fourth week 4 days, fifth week 3, sixth week 2, in final week 1 day. In a lower, in an upside down triangle manner, in that manner, we have to make a lockdown in that regard, so that active days will be gradually keep on increasing.